Hello, I am Dr. Biswas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, doctor, I'm Mrs. Jessica Alba, 31 years.
Okay, Mrs. Nice to meet you. I have got a letter from your GP saying that you have loose stool for last 3 months. Is it right?
Yeah, doctor, yes.
So I am going to take a detailed history and all the information during our discussion will be remain confidential. So is that okay for you?
Yes, doctor, it's okay.
So can you please tell me in more details what is happening with you?
Well, doctor, for actually the last three months, actually, I'm noticing that there is some change with my bowel habit. Okay, I have to move my stools more around at least 6 times per day, 5 to 6 times per day, and I think it's sometimes I think some mucus is also present, doctor. Okay, so I'm not sure what's causing this. And previously, I didn't have this type of issues with my stool. It was quite okay. I think I had stool for once or twice a day, and it was okay. But now it's quite for some few days actually. And someone told me that these type of things can occur due to some uh, anxiety issues. So I'm not sure whether it's due to this anxiety or not. But hearing this, I'm getting more and more worried actually that whether it's true.
Sorry to hear that. And, can you remember that did it started suddenly or gradually?
I think it started gradually though, because I can't specifically tell you the time limit. It's 3 to 4 months back. Okay.
And can you remember that did it started following any abnormal events like any fever or
No, no,
anything else?
no, doctor. I cannot remember any.
Okay. And
But it's true, doctor, that uh, previously I think I had some. I went to a tour. Okay, in Africa. That was around 7 to 8 months back. Doctor. Okay, that was around 7 to 8 months back, and after coming back from tour, okay, during the tour also I had some problem with my bowel. I had some what the GP called gastroenteritis or something like that, and I took some medication for that. And after coming back, those symptoms were quite resolved. They were once or twice, I think, in the month, some those issues. Okay, for the last 3 or 4 months. Went around 7 months back to Africa. After that gastroenteritis, it went quite well for the last 3 or 4 months. But for the last 3 months, I'm again having this problem with my stools, my motion.
do you think that your previous problem and this problem with this episode is similar or different?
Well, doctor, at that time I also had some fever. Okay, with some loose stool. Okay, but this time I don't have that fever. I don't have fever, and it's only about my motion, bowel motion.
How frequently you have
And
to
at
pass
that
your
time I
bowel?
also had some vomiting. At that time I also had some vomiting, some fever. So that was a quite serious issue, I think. But I don't have any fever or vomiting.
Okay. And this time, how frequently you have to pass your bowel?
I told you, doctor, 5 to 6 times.
Any night time pass of your bowel? Did you?
No, doctor, I haven't seen, noticed once or twice maybe, but I haven't been so much bothered about it.
Okay. And can you tell me the consistency of your stool? Is it hard, solid, or just
Not hard, doctor. Solid to semi-solid.
okay? And have you noticed any abnormal constituent in your blood, like any parasite, any ova, or anything else,
No,
any
doctor.
fat
No,
droplet,
no, no,
any oil?
no, 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 no.
Have you noticed ever any blood in your stool?
Never, doctor. I've never noticed. It's only I have only noticed some mucus.
Have you noticed that is it difficult to flush away?
Yes, doctor. At times it's difficult to flush away. I think recently it's getting difficult to flush away. It's true.
Do you have any pain in your tummy?
No, doctor.
Any feeling of nausea or vomiting?
No, doctor. I don't feel like that
How about your appetite?
quite well.
Do you feel any urge to pass your bowel?
No, doctor.
And you said that you don't have any pain in your tummy.
Yes.
Have you noticed anything that makes your symptom better or worse?
No, doctor. I haven't noticed like anything, any food or something like that. I have noticed. I haven't noticed.
Okay. And how is this condition affecting your daily life?
It's quite affecting me, doctor. Actually, I work as an agent. Okay, my marketing agent. Okay, so I have to move house to house for my marketing purpose. And since this power movement is increasing, so I've been worried and it's hampering.
I will try to contact the social care department so they can look into your matter. Is that okay for you?
Yes, doctor.
And do you think that your bowel frequency is increasing day by day?
Yes, doctor. I think so.
And may I know that do you have any anxiety or stress, any mood problem?
No, doctor. I didn't have that anxiety, but after listening that this can be caused by anxiety, I am feeling more anxious.
Okay. May I know that do you have any headache,
No,
any generalized weakness,
no,
any rash anywhere in your body,
no,
any hot or cold preferences,
no,
any racing or pacing of your heart,
no,
any chest pain,
no,
any shortness of breath,
no,
any lumps or bumps,
no,
any weakness at any side of your body.
no.
Can you tell me about if you have any specific diet or a specific food pattern?
No, doctor. I haven't found.
Uh, what is your constituent of your food?
Well, doctor, I have normal food, doctor. There is nothing significant. I sometimes I have some dietary fiber, like what you say, vegetables, fruits, and sometimes I also have some meat. And a very red meat is not that much that I consume. It's limited.
Have you noticed any changes in your weight?
Doctor, not significantly.
And, do you have any problem with your water?
No,
Okay. And do you have any past medical condition that you would like to share?
no, doctor. I just had that issues with my gastroenteritis when I went to Africa. That's all.
Are you taking any medication?
No, doctor.
Okay. And do you have any allergy to any medication or any food?
No,
Are you taking any over the counter medication?
no,
Any herbal products?
no,
I am sorry to ask, but do you take any IV drugs or any intravenous drugs, any recreational drugs?
no, no,
That's fine. Any of your family member have this type of condition
no, doctor.
or any other condition that you would like to share?
No, doctor. I don't know of any.
Any history of cancer in the bowel?
No, doctor.
May I ask you a few more personal questions?
Of course.
Do you smoke cigarette?
No,
Do you drink alcohol?
within social limit.
You said that you are working as a marketing officer,
Yes.
and I am going to ask you a very personal question. It is important to know. Please don't take it personally, but I need to ask this question to reach a diagnosis.
Yes, yes.
Are you with a regular partner?
Yes, doctor. I'm regular. I have a regular partner. I've been married. Okay.
Have you ever had any casual relationship?
No, doctor. No.
Okay. And is your family supporting enough?
Yes, doctor. I think quite supportive.
Do you have any pet at your home?
No, doctor.
Except the travel, do you have any other history of travel?
No.
Okay. And during the travel, what medications did you take? Can you remember?
Well, I think I took doxycycline, doctor.
And did they help?
Yes, I told you that actually that was quite resolved. And after coming back, I just had those symptoms once or twice a month. But now, for the last 3 months, it has been increased bowel problems.
And have you ever consulted for a bowel problem previously?
No, doctor. Just I went to the GP during that Africa travel, and since then, no involvement.
Remember? I can understand. So, do you want to add anything?
No, doctor. Nothing whatsoever happening. Is it related to my anxiety or anything like that? What to do?
If you question that, do you take any pill?
No.
How about your period?
Quite okay, doctor.
And are you currently pregnant or wish to be pregnant?
No, doctor. No.
So as far as I have taken your history, I need to examine you, then I could give you the best explanation. As you have these symptoms, so there are few possibilities that can happen with this type of presentation, as you have low blood and also you have diarrhea, recurrent diarrhea for a few months. So there is some problem that is related to your bowel that can happen. Sometimes we call it celiac disease. That is a possibility, and also there are other possibilities like we call Crohn's disease. Do you have any idea about those?
I have this hard about it. I don't know anything else.
Okay. Actually, we are not quite sure what is happening with you, but we need to examine you. We need to do this blood test to see what is happening with
Okay.
you.
Mm-hmm.
After that, we can give you the best explanation.
Okay.
We are going to do this
Okay.
test, and after the results come, we may need.
Well, is it related to my previous problem in my bowel during Africa?
It can be related, but your CP has done some test and it didn't find any abnormality. But it can be related. Sometimes there may be some bugs in the bowel that can happen, that can cause this type of symptom. So actually, we will do this test again, and after that, we will get the results. Getting the results, we can tell you exactly what is happening with you.
Okay, doctor. That's all right.
So, do you have any other question?
Do I need admission now?
I think you don't need admission at this point, and we can manage it at outpatient basis. Time off.
Okay. 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 So thank you, doctor.
Thank you.
Okay. So what are your duties here?
For this lady, my differentials are this can be a case of celiac disease, then can be a case of inflammatory bowel disease. Then I would also consider for this lady uh, hyperthyroidism. I would also consider chronic bowel infection like any parasites.
Okay. 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 What about you? That well, I think you have known about post-enteric enteritis enteropathy. So is it possible here because he had some issues with Africa and it has actually not completely resolved. He told
Yes,
that he had
yes,
some issues
yes, that is
once or
that is
twice a
possible.
month. Okay,
Yes, that is a possibility.
yes, because he actually told that hasn't resolved completely since after coming from Africa. And actually, you told about Crohn's, but you yeah, I can I am I know that there are some symptoms of Crohn's, some symptoms of celiac, but you know that there is no oral source there of celiac, no rashes, and no specific food pattern was associated.
Yes,
Okay,
I
and
think
for Crohn's also
I think post infective that is called
enteropathy.
enteropathy. That is a good possibility. I forgot to mention it.
Yeah, because I think also because since her symptoms actually didn't quite resolve. Okay, she told that she has some attacks once or twice a month. So that I think that should have been an important DD in this case. I think so. Okay,
Yes,
and also when you that's true, but I think you have excluded very well because you have excluded some tummy pain and also excluded amounts of respiratory symptoms. But this could have also been a case of cystic fibrosis, and you have excluded it very nicely. Okay, but cystic fibrosis can also patients can also complain about this type of malabsorption, and also uh, you have excluded other causes. But I think I have one question that I think you could have asked about some any difficulties in swallowing and any funny color changes, because I think sometimes systemic sclerosis can also present with this type of symptoms
yes, I forgot.
since she was male.
Yes,
Okay, yeah. So I think that could have also been asked. SLA could have been asked a bit some hair loss. You asked about uh, rashes, but you didn't ask about oral sores and loss of hair, and also some joint pain. Okay, and I think color changes. I think these
yes,
issues, if asked,
at least
this
wherever systemic sclerosis would
yes, I
have
think
been
this
asked.
should have been better. And some flushing, I think, should have been asked. Okay, flushing and wheezing,
Yes,
because for carcinoid.
carcinoid
Okay,
syndrome. Yes,
carcinoid, yeah, and others have been included more or less, and that this has been, I think, good. Okay, and I think that this has been good more or less, but I think the main DD should be post-enteric, post-enteritis enteropathy. I think this should have come first. I think. Okay,
yes.
regarding her symptoms. Okay, and now what? How do you think that you will investigate the patient?
Okay, I would go for the routine blood investigations, complete blood count to see his hemoglobin level and white blood cell count and inflammatory markers, and after that peripheral blood film. Then I will go for the liver function test, renal function test, and urine for routine investigations, random blood sugar level, and in this time I will also go for stool for routine examination, especially for fresh stool, and
Mm.
also I will go for the endoscopy of upper CIT.
Okay, okay, and how can be the management? I think this is a difficult one, but how can you manage the patient?
Okay, this is a case of infective post gastroenteritis enteropathy. Then I think educating and counseling the patients, then going for some tricyclic antidepressant, some anti-motility drugs would be appropriate for her.
Okay, okay, and okay, that's good. That's very good. So I think you have done fairly well, doctor. So thank you. Okay.
And,
So
yeah,
any more issues?
okay, one thing that I think asking about, I also asked, tried to ruled out, but can ACV be a presentation of loose?
No. You actually asked because the HIV enteropathy can be present like this, but you asked that any casual relationships and anything. I think because you asked that her private life, so she actually ruled it out. So I think you asked it indirectly. But HIV can also cause this. I think HIV, TB, long-term TB, HIV, giardiasis, even salmonella. Though they are bloody, salmonella, shigella, campylobacter, they can also be cause this thing. But usually they are bloody ones.
So
And this I think this you have actually raised those issues: fever, TB. I think these have been raised. Okay.
So for exam cases, what the differentials we should think for a case of diarrhea?
For exam cases, I think very important for UK purpose, I think, is malabsorption syndrome, specifically celiac, Crohn's, cystic fibrosis, and this post-infective enteropathy. And again, very important for PACES purpose, I think, pyrotoxicosis. Pyrotoxicosis, carcinoid syndrome, okay. Uh, then carcinoid syndrome, and sometimes main syndrome, main type 2, with medullary thyroid carcinoma. They can also come with chronic diarrhea. And never, and for PACES purpose, always rheumatological conditions are important. So systemic sclerosis, SLE, it should have been excluded, specifically systemic sclerosis, and also HIV, because HIV is an important cause for HIV enteropathy. And again, chronic pancreatitis should be included, and cystic fibrosis, and I told about cystic fibrosis. I think these are the main important issues here. And also, infective and inflammatory causes have been brought into this headline. And never forget about any malignancy, specifically history of bowel cancer. Okay, and that can be excluded in the history by taking by which you took any nighttime diarrhea or any nighttime episode. This is a very important marker for any important organic involvement, I think. And do you want to add anything?
No.
So I think it's quite well discussed. Okay, so I think we can stop the recording.